The Forgotten Pandemic: How the Spanish Flu Changed the World. Picture yourself in the waning days of 1918, a world in turmoil from the devastating effects of World War I. The streets are filled with anxious crowds, hopeful that peace will soon return. Yet, unbeknownst to them, an even more insidious threat lurks in the air, one that would claim more lives than the Great War itself. This invisible adversary, the Spanish flu, would go on to reshape public health and alter the trajectory of global history. The genesis of the Spanish flu can be traced to the congested military camps, where soldiers lived in close quarters under unsanitary conditions. In such an environment, viruses found fertile ground to mutate and spread. What began as isolated cases of mild illness quickly escalated into a full-blown pandemic. Medical personnel, equipped with rudimentary knowledge and limited protective gear, struggled to contain the virus as it spread like wildfire among the troops. These soldiers, unknowingly carrying the deadly pathogen, would soon transport it across continents. The interconnected nature of global travel during World War I allowed the Spanish flu to traverse oceans and continents with alarming speed. Soldiers returning from the front lines brought the virus to their homelands, where it rapidly infiltrated civilian populations. From bustling American cities to the remote villages of Africa and Asia, no region was spared. The unprecedented mobility of human populations facilitated an unparalleled diffusion of the virus, leading to a pandemic that would ultimately infect 1/3 of the world's population. Unlike previous influenza strains that primarily targeted the elderly and infirm, the Spanish flu exhibited a peculiar lethality among young, healthy adults. The virus triggered an overreaction of the immune system, causing severe inflammation in the lungs and, in extreme cases, cyanosis, a condition in which the skin turns blue due to oxygen deprivation. Hospitals were overwhelmed with patients exhibiting high fevers, severe headaches, and relentless coughing. Medical professionals, lacking antibiotics and antiviral treatments, resorted to rudimentary care, often unable to prevent death. In response to the escalating crisis, public health authorities implemented stringent measures to mitigate the spread of the virus. Mask mandates, social distancing, and the closure of public spaces became commonplace. Citizens were urged to avoid large gatherings and to don protective face coverings. Despite widespread resistance and misinformation, these interventions proved instrumental in reducing transmission rates. This period serves as an early testament to the effectiveness of community-wide preventative measures, which would become foundational in future public health responses. The Spanish flu's impact on global mortality was staggering. Over the course of 2 years, the virus claimed an estimated 50 million lives, far surpassing the death toll of World War I. Entire families were wiped out, and communities were left in mourning. With no effective vaccines or antiviral drugs available, societies were left to rely on non-pharmaceutical interventions and basic nursing care. Mass graves became a grim necessity as morgues and cemeteries reached capacity. The pandemic not only decimated populations, but also left an indelible scar on the collective psyche of the era. Amidst the chaos and despair, countless medical professionals, nurses, and volunteers emerged as unsung heroes. These brave individuals risked their lives to provide care to the afflicted, often without adequate protective equipment or medical resources. Many contracted the virus themselves, sacrificing their own well-being for the sake of others. Their dedication and selflessness laid the groundwork for future advancements in public health and inspired a new generation of medical professionals. The Spanish flu served as a catalyst for significant advancements in medical science and public health policy. In its aftermath, governments established national health agencies and improved disease surveillance systems. Scientists, driven by the urgent need to understand viral behavior, made strides in virology and vaccine development. These lessons paved the way for future responses to pandemics, including the development of influenza vaccines and the establishment of the World Health Organization. The Spanish flu pandemic of 1918 remains a poignant reminder of humanity's vulnerability to infectious diseases. Though it faded from public memory, its legacy endures in the scientific and medical advancements that followed. As we confront modern pandemics, the experiences of 1918 guide us in our efforts to protect global health and prevent future tragedies. By learning from the past, we equip ourselves to navigate the challenges of the present and safeguard the future. If you found this journey through history enlightening, be sure to like, share, and subscribe for more captivating stories from the past.